And as I sat down, I said to Rebecca, I'm not Arnie Milstein. And she said, yes, I know Arnie Milstein, and you are no Arnie Milstein. So none of us are. I know, exactly. But so Arnie needs to be in Palo Alto at the last minute. So right before the holiday weekend, he had to stay in Palo Alto. So I will pinch hit, but I have all of his notes. So we will follow his script as best possible and move forward. I think what we're going to shift gears to, if we were thinking about muddying the waters this morning and adding more complexity, just to make sure we understood it and talked about it, this afternoon is really beginning to talk about bright spots and really places that and programs and ideas. We heard some of those this morning, but this will be much more intentionally around programs, projects, ideas that have been implemented, have shown results, and that are very promising. And so I think this is a place that you look to where you begin to see what the future could look like and begin to examine what some of those key elements are. And so what we'll have is we actually, I think, have, again, in this session, ample time both for presentations. I'll ask a few questions of the panelists just to draw them out a little bit more, and then plenty of time for all of us to speak. So what Arnie, which I'm channeling here, asked, and I think it's great, so I'm sticking with it. He asked each of the panelists to give a brief synopsis of the active ingredients of the intervention. So kind of what were the key elements for these high-need populations. Some currently available information, the kind of so what, about the percentage and absolute effects of the intervention on all or some measures of performance that comprise a triple aim. So kind of what are some of the early results, findings, details, quantitative analysis. And then your opinion as experts and folks who are doing the work on what was most and least successful about the intervention program, and just beginning to share some advice, previewing our next panel. We're beginning to share some advice around how we could deal with similar populations or care for other related populations. So Arnie left me a cryptic note that said he was going to do it alphabetically, and I didn't know whether he meant first name or last name or which alphabet. So we're going to start with Bonnie LaPlante, who is from Healthcare Homes, Minnesota. She's the Interim Director and Capacity Building and Certification Supervisor in the Health Policy Division at the Minnesota Department of Health. Welcome.